So, John, last question to you is about something that you just raised in passing, which is telemedicine. How much of an opportunity does telemedicine provide to address rural healthcare crisis, as you've described it?
Well, I think it's really exciting because suddenly, for the first time, you've got high quality video, real time contact with docs and pretty much any specialist you'd want available via telemedicine. I think telemedicine would be helpful in terms of follow up chronic care, some basic monitoring and connection. I just don't want to oversell the value of technology. I think there's a lot of medicine where you either need to be in person to do a scan, a study, take a sample, or just observe. And then I think there's a lot that you lose if you're not actually someone who's trying to counsel or work with a patient or a family isn't in front of them. So I think it can be a critical infrastructure support and extender, but I don't think it's a replacement. What say you?
Well, John, I'm sticking with your doom and gloom moniker. I think it gives a lot of opportunity, and we can help to even out some of these things. In cities, you have too many specialists. In rural areas, not enough. And telemedicine is actually a good way to link them. And you've seen some good efforts like Project Echo in New Mexico, which saves people the trouble of having to come all the way into Albuquerque by having specialist level care where they come from. That goes back a few years. So I think it has a lot of potential. I'm going to end it up right there, John, before you have any doomy, gloomy more things to add.